I call the next debate. Sandra Osborne.
Thank you, Mr Hood. It's a great pleasure to serve under your chairmanship today. I am raising this debate today as part of an ongoing discussion which has been taking place on the subject of gay to straight conversion therapy. I refer to the early day motion in my name, which attracted 52 signatures, also the petition presented to the House by my honourable friend, the member for Kingston upon Hill North, and the proposed private member's bill on the regulation of the psychotherapy sector by my honourable friend, the member for Swansea West. Certainly.
I'm very grateful. Can I first of all congratulate my honourable friend for securing this debate, but also I just wanted to put on record the enormously helpful work of Tom Stevens and Colin Livet, who live in Hull, who were behind the petition that was presented to Parliament and felt very strongly about this matter and that something had to be done.
Sandra Osborne.
Yes, I too have reason to be grateful to these people as well. But I would also like to place on record, Mr Hood, there were a number of honourable members who indicated they would have liked to attend today's debate, but for other commitments. Conversion or... Certainly.
As you were so kind to mention my bill here, the Counsellors and Psychotherapists Regulation Bill, would you agree that our joint ambition to get rid of gay to straight conversion therapy needs to be embraced within a regulatory context and regulating all psychotherapists who currently aren't regulated, of course?
I do agree, Mr Hood, and I intend to go into that further in my remarks. Conversion or reparative therapy is the attempt by individuals, often posing as professionals, to try and alter the sexuality of lesbian, gay or bisexual patients. Virtually every major national and international professional organisation has condemned this practice as ineffective and potentially extremely harmful to patients. Certainly.
Much we've been waiting. Can I place on record representing Brighton Kent Town, as I do, that has some 6,000 gay men, how very proud I am of that fact and how totally unacceptable a conversion of any sort is in this day and age.
I thank the honourable member for his intervention. The prevalence of the practice in Britain has been the subject of recent interest in Parliament, as I say. Members will have received a recent communique from pro-conversion group Core Issues, calling on us not to support the private member's bill and my honourable friend on the regulation of counsellors and psychotherapists. Core Issues are the very same people who tried and fortunately failed to put up posters in London buses advertising conversion therapy. And on the 30th of January this year, alongside Christian Concern, they also hosted a debate on conversion therapy in a committee room in this House. One of the speakers at that debate, Canadian psychiatrist Dr Joseph Berger, is on record as advocating the bullying of cross-dressing children in schools. Surely.
I'm very grateful to his fellow members giving way. Would you agree with me that these courses are particularly dangerous for young people who are struggling with their sexuality? I knew when I was a teenager and having great difficulty in reconciling who I was. The availability of these courses places an enormous burden on young people who are already really frightened about the consequences of being open about who they are.
Can I remind honourable members that this is a 30-minute debate, and if there are going to be interventions, they have to be very brief and allow the honourable member who has the debate to speak to the House.
Thank you, Mr Hood. In this debate, I want to focus on the main aspects of the problem of conversion therapy and also to debunk 3 common myths. The first is that conversion therapy is just something that happens in America. The second is the argument that conversion therapy is only carried out by religious fundamentalists operating outside of professional channels. The third myth is that we should see the debate about conversion therapy in very simplistic terms as a debate between allowing people to freely choose conversion therapy or infringing people's personal choices. On the contrary, I hope to show that conversion therapy is a very real and present danger in Britain, that more than just a problem amongst religious fundamentalists, it's an issue for the National Health Service and professional sector, and that this isn't a simplistic debate about freedom to choose. If LGBT patients are coaxed into undertaking therapy by peer pressure or referred on to conversion therapists after approaching professionals, then this is hardly a free choice at all. Certainly.
Would you agree with me that up until now the Department of Health have been actually very weak on this, and rather than simply not condoning it, they should outright ban this voodoo medicine and this so-called conversion therapy?
I do agree with the honourable gentleman, and I hope to get some answers from the Minister when he responds. Conversion therapy used to be a much greater, more systemic problem in Britain than it is today. In the 50s and 60s, LGBT patients were routinely forwarded by teachers, GPs, and in the case of Alan Turing, criminal courts, to NHS specialists in sexual orientation treatment. During this period, all branches of psychology, from the cognitive to the behavioural and the psychodynamic, had their own cruel and unpalatable methods of dealing with same-sex attraction. The watershed moment came when homosexuality was removed from the American Diagnostic and Statistical Manual of Mental Illnesses in 1973. But simply changing the rules, Mr Hood, as we know, doesn't necessarily change an entire system overnight. Conversion therapy persisted and psychotherapy remains an unregulated profession in Britain. Anyone in the country can set themselves up as a psychotherapist without being part of a professional body, and there are professionals practising in the NHS and therapy sectors who received their training well before homosexuality ceased to be classed as a mental illness. Even the new intake are a cause for concern. A 2008 survey of 226 British psychology undergraduates published in the Journal of Homosexuality found that only 66% agreed with an equal age of consent. It's in this context we should view the extent of conversion therapy in Britain. In a 2009 survey of over 1,300 accredited mental health professionals, nearly 300 willingly admitted to having attempted to change at least one patient's sexuality. Even more shockingly, the therapists admitted that some 35% of the patients they treated were referred to them for treatment by GPs, and 40% were treated inside an NHS practice.
Would Honourable
Sure.
Would Honourable agree with me that this is a very, very serious issue, that it is so widespread amongst GPs and other professionals, and that is something we also need to tackle in tackling the regulation of the psychotherapy itself, but also the health professionals in referring people?
It is a very serious issue, and I don't think it's recognised to the extent it should, which is one of the reasons I'm so pleased we're having this debate today. In 2010, an undercover investigation by the Independent's Padraig Strudwick completely vindicated this study. One psychotherapist who attempted to cure him, Leslie Pilkington, readily admitted that most of her clients were referred to her from her local GP's surgery. Many professionals quite simply receive little training in what to do when a gay person approaches them expressing uneasiness about their sexuality, as the honourable gentleman said earlier. There is a legitimate concern that some professionals in the NHS and elsewhere are referring LGBT patients on to conversion therapists. To address the problem of conversion therapy in Britain, we need to adopt a range of measures. In the therapeutic profession, affirmative therapy, which starts from the premise that no effort should be made to change sexuality and that homosexuality is perfectly normal, should be promoted as the appropriate, healthy way of assisting LGBT patients feeling uneasiness about their sexuality. To promote this therapy, we need to ensure that therapists and students are properly trained in LGBT-friendly mental health provision. In driving forward these reforms, the public sector equality duty, which mandates the public sector to address inequality in services, is absolutely vital. This is why recent government calls to review the duty are particularly concerning. It's important to consider the role of the public sector equality duty can play in improving the quality of care for LGBT patients. So I would ask the Minister, what initiatives has the Department of Health supported from the Equality and Human Rights Commission, for example, NGOs such as Stonewall, to identify and promote good practice in relation to the public sector equality duty in relation to LGBT patients. We know that when public bodies are proactive, it can make a real difference. Secondly, we need to explore the issue of the regulation of the psychotherapy. At the very least, psychotherapy has to become a protected profession in which nobody can legally call themselves a psychotherapist without being accredited to a professional body. We also need to ensure that professional bodies have an appropriate complaints procedure so that LGBT patients who do undergo conversion therapy can achieve justice. Patrick Strudwick, who I referred to, has raised concerns about the complex bureaucratic process he had to go through to ensure the conversion therapist who treated him was struck off her professional body. We also need to ensure that psychotherapists who aren't members of professional bodies, which explicitly have positions against conversion therapy, are not commissioned by the National Health Service. Can the Minister tell us whether groups without professional affiliations are commissioned by the National Health Service for services? And what about the advertising I referred to earlier? A New York Times advert in the 90s for conversion therapy is credited with causing a revival in the practice. That is why restricting advertisements for conversion therapists is so vital and should be explored. What is the Minister's view on that? The very least the government must do is to enforce practitioner full disclosure. This was advocated as their desired alternative to the model of HPC regulation in the Maresfield report of 2009 and involves the establishment of an independent body to administer a register of therapists, with the statutory requirement that anyone practising a therapy supply full details of training and professional history. The government's regulatory model for psychotherapy falls far short of PFD. Why? And finally, I want to raise the question of the role of the law in tackling the practice of conversion therapy. The government could opt to ban conversion therapy for all under 18s and go further with an all-out ban for all age groups, as happens in other countries.
On that point.
Certainly.
The Honourable Lady and congratulate her for the measures that she's outlined and support fully. Isn't it the case that in 21st century Britain, no lesbian, gay, bisexual or transsexual individual should be accessing this kind of voodoo psychology, and instead we should be providing services which help give confidence and support them in discovering their sexuality and about themselves, rather than making them feel more ashamed about it?
Totally agree, and thank the honourable gentleman for his contribution. But in addition to a ban, we must go further in terms of the training of professionals who are dealing with LGBT patients and provide friendly public service provision. Other than a solitary remark from the government that the government does not condone conversion therapy, made in response to a written question tabled by my honourable friend, the member for Kinston-upon-Hull North, the government has said nothing about its views on conversion therapy. I look forward to the contribution of other members and, in particular, the Minister's reply to the issues I've raised.
Order. I have received a letter informing from an honourable member requesting permission to speak in the debate. She assures me she's had the agreement of the member, and the Minister has told me when they come in. Can I just say, to be fair to the Minister has to have the same time that the member had in moving her debate. So I can ask the honourable member to have a few minutes, and I'll hopefully leave time for the Minister.
Thank you, Mr Hood. I congratulate the honourable member for Carrick and Cumnock for securing this debate and on her very powerful speech setting out the problem that we're hoping the government can solve. I also thank her, the Chair and the Minister for allowing me and other honourable members to make small contributions to this debate. I should also pay tribute to the many MPs on all sides of the House who have campaigned on this, particularly my honourable friend, the member for Swansea West, for his excellent private members' bill, and indeed my honourable friend, the member for Hull North, who did a national petition on this issue. Mr Hood, this debate comes during an important week for the LGBT community. On Monday we celebrated the 10th anniversary of the abolition of the wretched Section 28, and today is the annual Transgender Day of Remembrance, where we remember the thousands of transgender people across the world who have paid the ultimate price for